Let's talk through inMIND study. This study is looking at Tafa and Len with rituximab in second line. Pallavi, can you discuss the study design and its findings?
Absolutely. So this was kind of one of those sneak attacks in ASH. And honestly, the study was not really on my radar before ASH, but the results were pretty good. This is the inMIND study, which was a randomized study which evaluated the addition of tafasitamab to a standard of care regimen, lenalidomide and rituximab. So as we know, lenalidomide and rituximab is approved in second line setting, and also we tend to use it in first line setting in select cases. So there's a good track record of benefit of LEN-R. They basically randomized patients 1-to-1 in the second line setting and added tafasitamab on top of the two drugs. So it's basically one of those doublet versus triplet studies. The primary endpoint was progression-free survival, and the study did show a very significant progression-free survival, 13.9 months versus 22.4 months. The overall survival was not statistically significant, yes, because this is follicular lymphoma and there are so many different lines of therapy that patients can get. But the margin of benefit was pretty good for progression-free survival. I think we have to wait for FDA's determination on this combination, but it would be very surprising if it didn't get approved.
This is clearly an active agent, right? And we've seen this agent already approved in refractory diffuse large B-cell lymphoma as well. Pallavi, in community practice, we're very comfortable using lenalidomide and rituximab. Tafasitamab, we have limited experience. Can you touch on some key side effects that we might run into and some management around that?
Yes, absolutely. One of the biggest side effects of tafasitamab is time toxicity. This regimen has to be given weekly for the first 12 doses. So that's like 3 months of coming every week.
Okay.
And then it's every 2 weeks for a few months, and then it becomes once a month. That's a lot for patients. Other than that, tafasitamab is very well tolerated. If you read the package insert and look at the trial, it does worsen cytopenia some. But in my experience, patients just come get it and they leave. It's very well tolerated. In follicular lymphoma, there's a lot of room for dose modification. You might treat a few patients on label, but then realize, do you really need that much drug? And you might try to skip a little bit later.